Warmth, connection, and emotional closeness is what it is to be human. Oftentimes, though, this is exactly what the client is missing. They feel sad, they feel alone, they feel isolated, and at times very, very far away. How exactly, as a therapist, do you observe this? How do you spot this? What are the signs? Welcome to the Art of Therapy, Season 2, Episode 10.
Glad to be back here with you in the studio and that we just further explore the art of therapy.
Yes, I am too.
Just looking a bit back at the previous episode. So what we looked at is really looking at communication and what an important aspect that plays for a therapist in observing how a client communicates. Because what you said is that how clearly or unclearly a client communicates, how that can be linked to their presenting complaints. And once a therapist is aware of that, then of course it becomes very visible in how to be able to assist a client as well.
Yes, so much, because we had explored together the communication model, that how nuanced, how challenging communication is. It's so meaningful. It's remarkable, but also how challenging, and one's ability to really communicate clearly and express oneself so clearly is such an important part of how we relate, of how we interact, and understanding that in relation to the presenting problem, or again, the inability or the difficulty in communicating meaningfully, and how does that connect?
Yes, yes. So you mentioned connection as well now there, and that's a part that we said that we'll look at today as well, is how important is connection and how important is that for a therapist to observe in a therapeutic relationship.
Yes, this is key because it has to do with the nature and quality of how we relate. We know that how we relate and the nature and quality of our relating will also determine the nature and quality of our well-being. And connection is part of that. And when we're referring to connection, it's a very special quality which has to do with emotional closeness in an interaction, in a relationship. Charl Vorster, in his book Impact, the Story of Interactional Therapy, had noted the importance of emotional closeness, or the converse, emotional distance. So when we look at connection, really what we're looking at is, as clinicians, is how does someone relate in terms of emotional closeness, or being further away, emotional distance.
So the connection, the emotional closeness and distance, it plays an important role. And it makes me think that there's also, again, not a right or wrong. It's not whether you should be close or whether you should be far, but it's dependent on the relationship and what is the nature of that relationship.
Yes, so much. Because just as you've noted, it's that relationship. What is going to be optimal or best for that relationship within that context and within the roles that are being fulfilled? Roles have certain qualities that, to the extent we fulfill them effectively and appropriately, is going to be meaningful. And those roles can have some indication as to the degree of emotional closeness or distance, which is not right or wrong, good or bad, but what's going to be most appropriate or effective in terms of the distance within that interaction for those roles, for that particular context.
The question that I sit with is, how do you see it? What do you look for?
Yes, this is always the difficult part, as we noted, but therapy is also an art. So what does one actually look at? What does the therapist look at? So it has to do with two parts. As we've explored before, there's always what's occurring in the therapeutic relationship, because how the client is relating within the therapeutic relationship can be an indication of what they're struggling with or what they've come to therapy with. So it may relate to the presenting problem. So we're always going to be considering how they're relating, how they're communicating and interacting within the therapeutic relationship. And remember, it's not just them, it's ourselves as the therapist as well, because as we've been looking at causality circular, so in this moment, how I'm relating to you has an impact, and how you're relating to me has an impact, and we're responding to each other's impacts. And within the therapeutic relationship, the therapist is a participant observer. They're part of what they're observing. So it's important to just be aware that it's not only the client, but it's the therapist and client in their interaction, and understanding and considering what is happening there in terms of emotional closeness or distance. But just again to note that because it's not a social relationship, it's therapeutic, the therapist will be considering how does the client, and observing how does the client relate in terms of distance, that emotional distance, and how appropriate is that. But that's just one order that one will look at as the therapist, that emotional closeness or distance by the client within the therapeutic relationship. The second order, or second part, is going to be look at how does the client relate emotionally within their own primary system, within their own family. And of course, we can't observe them directly, but we can listen to how they talk about those relationships, how they talk about those interactions, and that can give us some clue as a therapist or clinician about the emotional closeness or distance in those relationships.
It's well, the way you describe it, it really is the art of therapy in being able to observe emotional closeness. Because my sense is it's actually such an abstract concept. So it's quite difficult to explain it and to show how to. But it's about it takes me back to training as well, because it's training this over and over and over again and checking it out, and seeing examples and working with it in a trained way to be able to actually understand it, because it is actually very abstract.
It is. And you're right about training. We looked at this extensively because part of training and therapeutic learning and development is really understanding this particular aspect of how we relate. And it is a very abstract quality. We know what emotional distance is. We have some experience of when we feel close or far from another. But what exactly is that? And moreover, how does the therapist observe this?
Yes. That it's how do you observe it, and like you said, it is how a person talks about. It gives us clue. It talks about the relationship, how much they maybe part of it is also how much they share with the other person, and so there's these clues in how the client talks about their other relationship.
Yeah, there are. We could just maybe just look at it first of all in terms of the therapeutic relationship and what a therapist can look out for in order to try and determine the degree of emotional closeness or distance. And then we could also explore how one listens out for and what are the qualities one's looking for to help make sense of what's happening in their system, the client's system.
Yeah, so there's actually quite a lot here that we can start to have a look at in emotional closeness or emotional distance as well. Is there more? What more do we need to look at? Hi, it's Marizaan, and I would like to tell you something extraordinary happening at Treatment Works. So if you are a healthcare professional and you would really like to deepen your therapeutic skills, training with Dr. Phipps is a must. In my experience, his training is so compassionate, it has high clinical excellence, and it makes therapy so clear. Training is also not just a space to learn, but it's also a space to connect, to share with others and learn from others. So if you are ready to deepen your therapeutic skills and to look at more ways to support your client, join us for training at Treatment Works. You're welcome to visit our website at treatmentworks.co.za.
Well, in terms of emotional closeness, it's such or distance, it's so important and really fundamental to how we relate, what our experience is as human beings, as people. So there is more, but perhaps just it may be helpful to note some qualities that a therapist can observe or look out for to help them make sense and evaluate or determine emotional closeness and distance.
Okay. Okay.
Okay, well, then what I would just note is that if we just pause with the therapeutic relationship, begin with that, it'll be, as you noted just now, it'll be how openly, in effect, the client talks about their difficulty. It'll be looking out for, do they maintain regular eye contact? That's one indication of closeness. Or do they maintain very little eye contact, minimal eye contact, which would indicate perhaps more distance? Or is it fluctuating, their eye contact? So at times closer, at other times further. So eye contact is important. Another aspect is where they sit. Do they choose to sit closer to the therapist or further away? Yes, there may be a chair, but then how do they sit? Do they is their posture more open towards the therapist? Is it turned away? How will they utilize their shoulders? Are their shoulders, is there more openness or more closed? So these are just some of the nuances, some of the basics of what one can look out for as a therapist. Also, if we just look at how openly, what we're looking at is how fully does someone express that? And very often it's that quality of, are they able to talk transparently? And when we mean openly, and also vulnerably. Now, vulnerable is a word we use a lot, but what do we mean by that? How do you observe it? How can you see it? Well, very often it's easy for us to talk about so-called positive emotions, positive, but how do we reflect on negative emotions? Or how do we talk about aspects that don't impress others? Or where we're able to talk more critically about aspects of who we are, or express potentially painful emotions relating to sadness, loss, envy, any number of emotions that are considered perhaps less attractive socially. How do we express those? And does the client give expression to that? These are all aspects that relate to what extent there's emotional closeness in the therapeutic relationship or emotional distance. Furthermore, what does a client do when, as a therapist, that you reflect an emotion? Does the client receive that? Do they accept that emotion? Do they develop on it and talk more about it? So what do they do with the therapist's reflection? And that gives some indication too of whether there's emotional closeness. If, for instance, the client were to dismiss it or respond in a way that's not congruent, just superficially receive it, yes, agree, but some other part of how they do that or communicate isn't consistent with it, that's an indication of more distance or possible distance. And again, it's not wrong or right. One's just looking at how does someone relate in terms of emotional distance and closeness. And does that connect with the presenting difficulty or problem? But again, that's just one order, one way, just looking at the therapeutic relationship and trying to make sense of the interaction within that context. But the other part is, how does the client talk about their family system, their primary system? Do they talk about those interactions in terms of warmth? So it's not only understanding, one can understand another, and we know that's empathy, but what's the quality of understanding the other, the way they talk? Is there emotional closeness? Are they able to reflect on how close or far someone is? So one's going to listen out for how they're talking about those relationships. Are they able not only just to talk sincerely, but in an involved way and with closeness and warmth? These are ways we can determine whether there's closeness in those interactions, or is there distance? Are their interactions characterized more by distance? Or is it fluctuating? They would share how they make time for, say, for instance, a partner, and their disappointment when a partner doesn't come close in the same way, or does something where there's a painful, hurtful impact. There one can see that there's some challenge around distance, that the client is really trying for an emotionally closer relationship, but there's something that they experience with partner where the emotional distance doesn't match that. So these are ways in which we can listen out for and try to understand what's happening in their primary system or family.
Yeah, it gives so much clarity. It's both on the therapeutic basis, which in the therapeutic relationship, which gives a lot of clues in essence of how a client usually relates. And again, it's not wrong or right, but it just may have an impact on the presenting complaints.
Yes.
But then also in the other important relationships, and looking at how close or how far they do relate. And does that have an impact on presenting complaints? And it's not always about what a person says, but it's the things, how they talk about them. So it's not about, are you close to your partner? That's not going to give an answer. It's listening carefully and in detail about how they talk about, for instance, their partner.
Very much. Yeah, so often it's for all of us what we think about ourselves, or how we see something, and how we express it, or how it's experienced, can be very different. So it's not someone declaring closeness. I mean, that's important, but it's also how do they express that, and is that consistent or congruent? That shows us so much about emotional distance and closeness. It's not only someone's intention or perception, it's how do they relate, and is that with closeness or emotional distance?
My sense is that we can almost spend a whole hour just on this one part, because I think there's so much richness to this and so much detail to this, but we're not going to be able to. But I think a part of this is that I think there's so much more, and that this is almost the surface level of emotional distance, and just having some understanding of it, I think, is already very valuable. So, but then just looking further, and what is some of the other qualities and other aspects that a therapist can look at to be able to guide and to give clarity.
Okay, I get it. So you want to move beyond emotional closeness or distance.
Indeed, yes.
Okay, yes. What that relates to, of course, there's more that a therapist can look at, and that's going to relate to Carl Rogers' work. So we would first need to look at that a little bit more before we go further.
Okay, sounds good. Thank you for joining us on The Art of Therapy today. We hope that you find this conversation really thought-provoking and meaningful. And if any of the aspects really resonates with you, please feel free to leave a comment below. Thank you for walking this journey with us. Until the next episode.